My name is Neil Oza, and I'm located in Hammond, Louisiana. The practice name is Advanced Dental Concepts. Well, I bought this practice about 4 years ago, and production-wise, revenue-wise, it was always doing really well. After about the second year, we decided to buy another practice and merge the two practices together. And it wasn't until last year where I finally hit like a little bit of a plateau and started realizing, okay, I'm dealing with some stuff that I'd never dealt with before. How do I handle this situation? You know, I had some turnover, so I was left with one assistant and one front desk person. I was like, okay, now what am I gonna do? It's like starting from scratch over again. For me, the biggest thing was the education aspect of it. Whatever direction you want to go, so say it's implants or endo, those types of courses are out there, and they show you how to do these things. You know, you get trained on these things. That was one of the biggest things for me. The aspect of not having to deal with the business side of things, the management side of things. They're recruiting people for me. I don't have to deal with, you know, getting on Indeed and posting stuff for resumes and sifting through interviews. They do all that up front. And I basically say, okay, I like this person. And I go, okay, we do too. Let's hire them, you know? So that was like a huge load off my chest, you know? So the first person I contacted was Mike Walker. And the first conversation we had, he basically told me, he goes, why do you want to sell to Heartland? You know, that was the biggest thing. And I went over all the reasons why. And so a few months later, I contacted him again. I think we're ready, you know? He goes, all right, if we want to do it, let's do it. And then after that, we talked to Scott Weedman. And so he was really instrumental in the whole process. I mean, he was great from the get-go. So the RMO was heavily involved with, like, okay, this is what we need to do. This is who's going to be involved with things. There's always constant communication via phone. She'd come down, said, okay, this is how things are going, you know? Are you feeling comfortable? This is the team you have on board. We're thinking about hiring an RBA. What's your thoughts on that? So the RMO was pretty instrumental in all that. For me, I feel like it's huge, because when you have that little bonus incentive, it pushes you to treat it as your practice, which still is my practice. It's just now you're more invested in it, you know, because you feel like, okay, I have something that I could work towards, not just for the business itself, but also I get something out of it too. And the staff feels the same way too. You know, like the hygienists have a bonus system. Overall, the whole staff will get something out of it too. So they see that. And they push for it because they're like, okay, we're all going to win at the end if we do better. We try to produce. How can we fill the schedule up? What other things can we do to make our production higher for this day? And they're actually the ones that are driving the practice now, and versus me, like saying, okay, come on, let's do this, guys, you know? Because they're seeing the value in doing that. Yeah, I'm looking forward to more courses, you know, taking the training for endo, you know, just hearing all these other speakers talk about it. I was like, yeah, I gotta get back into it. You know, that's one of the things I was always shying away from. Yeah, and just to network with other dentists that are part of Heartland, you know, visiting other practices, seeing how they're doing things, getting my team to visit those other practices too, to see it firsthand and how we can implement these systems. Before this, I had no connections with other dentists, besides people that you know in the community, dentists that I went to school with. There was no real mentorship program or anything like that prior to Heartland. So to have that and have access to it on a regular basis, that's awesome. You know, like I could connect with anybody via email, phone. I think the first thing they should probably do is contact people that have gone through Heartland, and then to have a talk. You know, like when I contacted Mike Walker, he was very open, friendly, and kind of asking the reasoning behind why you want to join Heartland. And if it aligns with you, then do it. You know, I haven't regretted it at all. You know, whatever you want out of this whole experience, I think you could get via Heartland.